Allow me to welcome and thank everyone for joining or for staying online for this side event. I am Dr. Gordon Galia, WHO representative in China, and I'm part of the team working on the operational shift on innovation for the future of the region. I ask my co-moderator to introduce herself.
I am Agatha, the virtual health coach. I am happy to be here.
Wow.
Welcome, Agatha. It is nice to see you come to life. We will welcome a distinguished panel of speakers. We will be discussing the theme of innovation from ideas to impact. Our focus today is on how countries foster innovation, but not just at the ideation stage, but from idea to the transition to scale, implementation and the transition to scale in countries. Our panel is very limited in time, so I kindly ask the indulgence and understanding of the speakers to stick to the allotted time. I will indicate when you have 1 minute left by just simply saying 1 minute. Agatha and I will be strict timekeepers, so please forgive us. So, Agatha, over to you.
Thank you, Gordon. I would like to invite Dr. Takeshi Kasai, Regional Director, WHO in the Western Pacific region, to open this side event on innovation. Over to you, RD.
Thank you very much, Agatha. Ladies and gentlemen, when we adopted the vision for the future, making our region the healthiest and safest, it became clear that we must change the way we do business. We choose to find a new path to break with the conventional solutions, and we choose the operational shift of innovation. We live in a world that calls for innovative responses to aging and non-communicable diseases, and promoting health across the life course rather than merely treating episode of illness. We live in a world where the climate crisis threatens the survival of the humanity, and we live in a world where health security is threatened by emerging and re-emerging diseases, and large segment of the population live short, unhealthy lives during which they are unreached by health or social services. And now, COVID-19 has brought us new challenges as well as resurfaced existing ones. Our response to the pandemic thus far has created an environment where we have an opportunity to accelerate innovations and to create sustainable and equitable future. Innovation and for the future has many faces. We understand that interest in technology and digital innovation, but we also need to prioritize social innovation, giving a voice to the vulnerable, drawing those populations who might be excluded by pure technological solution. In this side event, we explore the concept that innovation is happening all around us, in technology, in finance, and in society itself. Minister of Health must systematically harness this energy. We want to hear how member states are promoting innovation, how they are managing the transition to scale, and I also want us to ask, what does a regional engine for driving innovation look like? How can countries cooperate in generating this movement? And what is WHO's role here? I would like today's sessions, therefore, to be the start of the conversations. And beyond this RCM, we would like, over time, to catalog the innovations that you are developing in your ministries and in the governments. We'd like to work with you and scale those solutions that are shown to make a positive health impact for the future. And I look forward to our discussions today. And I commit WHO Western Pacific Region Office to continuing this process and building on the energy and synergy in our family of member states. Thank you very much. Back to
Thank
Agatha.
you, RD. We hope that all member states will encourage your national innovators to submit their solutions to the Innovation Challenge and participate in future innovation events in the region. I hand over to Gordon.
Indeed. Thank you, Agatha. We will hear more about the Innovation Challenge later on after our speakers. For now, we switch immediately to our two invited keynote speakers, one from the world of academia and one from government, but both concerned with the task of translating innovative ideas into broadly implemented real-world solutions. To lead off, I invite Professor Yuichi Tei from the School of Health Innovation in Kanagawa University of Human Services and the Center of Innovation at the University of Tokyo. Over to you, Professor Tei.
Thank you very much for kind interaction. Can I have my first slide, please? So today, let me talk about my experience in a systematic approach to fostering health innovation in Center of Innovation at University of Tokyo. So the Center of Innovation program was launched in 2013 to strongly boost industry-academia cooperation. It has four major characteristics, very distinct from conventional industry-academia cooperation. First, backcasting, start by envisioning a desirable future. Second, open innovation platform, transcend boundaries between various fields and organizations under one roof. Third, disruptive innovation, tackle projects that neither industry nor academia alone can handle. Fourth, potluck method, provide direct support only to academia for screening industry for serious commitment. Next slide, please. So as for backcasting, thanks to the universal health coverage and the free access in Japan, current mindset is I go to hospital if I get sick. So this mindset has been okay. However, if we look at the future demography below, this mindset will not be sustainable. So we need to change our mindset to I should take care of my own health. Next slide, please. Thus, we set our future vision, self-managing healthy society. We break this down into three sub-visions, from hospitalization to outpatient care, from outpatient care to home care, and being healthy at home. The first two sub-visions can be summarized to decreasing hospital stay and clinic visits by half, and creating new health and the medical industry. The last one can be summarized to prolonging healthy life expectancy and increasing labor productivity toward lifelong well-being. Next slide, please. With the finite amount of budget, we decided to focus the first subvision on medical technology innovation, especially day surgery. The second on disease prevention, especially diabetic nephropathy. Third, visualization of health. Third, on visualization of health risks, especially in stress, metabolic syndrome, locomotive syndrome, and the mild cognitive impairment. Underlying all these is the standardization of health and the medical ICT. Next slide, please. Let me especially elaborate on the visualization of health risk, the most preemptive subvision. So conventionally, we see the status of our body and mind as sick or healthy, dichotomous. But this concept really does not incentivize individuals for health promotion. So we have paid attention to a concept of mebio. Mebio is a concept that captures the status of our body and mind changing continuously from healthy to sick. And this concept promotes health personalization and thus empowerment and participation of individuals. This concept is closely related to WHO's intrinsic capacity in ICOP. To realize this concept, we need to measure and visualize MIBIO status. Next slide, please. Look at the green box. So first, we predict personalized health risks and visualize it with XR. Second, we provide personalized coping plans and incentives. Third, we assess and visualize the change with XR and back to square one. And then now, next slide, please. Now we realize as important is reassurance and trust by experts and health literacy. Next slide, please. And also presence of like-minded fellows who sympathize and encourage. And also gamification and routinization. If we can achieve all these three pillars, we can achieve health personalization and the behavior change. That's our hypothesis. Next slide, please. So this is the organization of the center. From the top, academic researchers with Cs matching the vision come together with industry or government with corresponding needs before us as a team. And the Center of Innovation involves all stakeholders in industry, municipality government, academia, and the private sectors from early stages of R&D, acting as a one-stop service center and facilitating speedy R&D. Next slide, please. So these are the major achievements so far. So we have put several products on the market, had a high impact academic publications. And above all, in the last part, in platform building, we have been transferring some of our catalyst function to private sectors. Next slide, please.
1 minute.
After substantial experiences, we refined a vision accommodating 100-year life and a rebroadcast. So we think we need to do two things. The first, data system reform, build a new data platform integrating medical care, data, and the daily life data for big data analysis, and the new value creation. Second, social system reform, work style in which there is no retirement age, no dichotomous opposition between elderly and young, and any healthy person can continue working as long as he or she wishes, and the insurance system in which payment is made for promoting or keeping health, not for losing health. Last slide, please. So in summary, we've extracted essential management strategy for fostering health innovation. Center draws a line between non-competitive and competitive areas in R&D as an NPO. As for non-competitive area, Center puts all stakeholders under one roof and catalyzes their cooperation. As for competitive area, companies should compete with each other. Center connects both areas with data platform organized by a new company. We find the first point most important. The center should act as an impartial judge and the catalyst for cooperation. Thank you for your attention.
Thank you so much, Professor Tei. So many lessons in such a brief time, backcasting from a societal vision through to a center for academic development and research and development, partnership with commercial sector, but also with society, bringing in personalized behavioral advice, drawing in big data, but applying it to the individual. I know I do not do justice, but just want to highlight some of the innovations you have given us an introduction to. I hand over now to Dr. Beverly Ho, Concurrent Director of the Health Promotion Bureau and Disease Prevention and Control Bureau of the Department of Health in the Philippines. She will speak on building health institutional capacity for social innovation. Over to you, Beverly.
Thank you very much, Dr. Gauden. As a health activist in the country once said, no one has the monopoly for love of country. In the same vein, I will actually say that no one has the monopoly for great ideas. And it is through this principle that we have implemented some of the efforts that we have undertaken in the Philippines. Today, allow me to share 3 examples of our efforts for social innovation, while at the same time also building sectoral and institutional capacities. First is when we launched the AHEAD program, or Advancing Health Through Evidence-Assisted Decision, which allowed us to provide research grants and establish study groups within the Department of Health. The challenge that we tried to address at that time was the shallow bench of health policy researchers in the country, as well as the limited capacity for evidence appraisal within the DOH. So despite having a steady increase in funding for policy research, we were producing the studies, but it was the same people who were doing it, and they were all retiring soon. Hence, the grants allowed guaranteed support for academic institutions for a period of 3 years to conduct researches, publish papers and priority topics, and train the next generation of researchers for graduate school. On the other hand, the study groups afforded the DOH to expand and deepen our capacities in health financing and health in all policies and health technology assessment, which led to legislations in the country on UHC, on sugar-sweetened beverage tax, and also provided the organization a base capacity for HTA, or health technology assessment, as well as community-based health impact assessment. The study groups were likewise mentored by a select group of local and international experts, both from the academe and practitioners. Our second innovation is when we collaborated with a behavioral design firm to pilot nudges for health workers to improve their overall well-being, especially in very stressful situations during the pandemic. For this, this entailed getting the buy-in of leadership in select health facilities, bringing together a small group of health workers and implementing simple interventions such as an SMS prompt, a wallpaper message, stress balls with audio guide, and posters in their bedside with linked guides to their meditation. As this was being implemented, our partners from the private sector were also made sure that our staff were actually trained or capacitated in designing behavioral interventions, knowing fully well that this will really be the future of many health promotion interventions. We are happy to note that this technology is now being run in 20 hospitals in the country from an initial group of 5, and we hope to scale this up even to primary care facilities. Our third innovation is when we work with several community-based organizations in the development of health promotion playbooks. And these target these 7 priority areas or behaviors which we want people to embrace, and which we want different settings such as communities, schools, and workplaces to build the environment so that these can be implemented easily. So we developed these alongside several of our partners from CSOs. As you can see, for each of the different behaviors that I've shown here, we have managed to develop playbooks. And each playbook would have a short evidence brief wherein they can really use it to lobby with their local legislator or their local chief executives. There's a template policy, their basic resource requirement checklist, etc., as even a communication plan, which every locality can customize based on their local context. I've also attached the link here, as you can see. So in all of these initiatives, we have also, of course, managed to use technology, and we've launched our newest website, a culturally appropriate health literacy driven website, which is called Healthy Pilipinas, alongside our chatbot, which we've run for during the entire course of the pandemic. So with all of these, it is going to be important for us to imbibe a culture of collaboration. It is very, very critical that we acknowledge the inherent strengths of being a government body, but humbly also recognize our limitations as well for which many of our partners can actually ably fill or even lead. In addition, we also recognize the need for a bolus injection of energy, and this can come in the form of efforts or programs that bring in young professionals, like what many of our examples have shown. And they have the needed skill set, context, networks, and experiences in other sectors that allow us to be a melting pot of ideas and collaboration. So with this, I go by ending this presentation by saying that we know the path towards UHC is long and winding, but we will be able to achieve this one province, one city, one community, one facility, one school at a time. And to be able to do this, we have to allow social innovation to grow, no? And rather than restrict it, we need to nurture it. And we will, as the Department of Health, have to be the lead, no, in making sure that a collaborative spirit will actually be available in order to nurture this to fruition. So thank you very much for this opportunity to share our work.
Thank you so much, Dr. Ho. Both our keynotes have very briefly given us two glimpses of applications of innovation in action. A common lesson is that the translation of research and development into policy, into solutions at scale, requires that ministries of health engage systematically with a managerial and institutional design that permits such innovation to be put into practice. So much more to discuss, but we shall now transition to the country-based panel. Over to Agatha.
After those exciting keynotes, in which we have learned about the ways in which countries can foster innovation, we want to hear about what member states are doing and how they have learned to innovate during the challenges of the pandemic. We have a distinguished panel from China, Fiji, Japan, and Singapore. Gordon has more to say.
Indeed, little more apart from introducing one by one our distinguished speakers who will now speak for their country as opposed to for specific research or innovation centers. All of them have been asked to consider an intervention of 4 minutes in which they answer questions related to how do you foster innovation in your country context, what structures and institutional arrangements do you have in place, can you give us an example of health innovation that you might showcase for the rest of the region. We are honored to start with the Minister for Health and Medical Services of Fiji, the Honorable Dr. Iferemi Wangainambete. Over to you, sir. I can see Fiji is online. Possibly there is a technical issue. Allow me, in the interests of time, until the issue is resolved, to introduce Dr. Chong Wei Yang, Deputy Secretary Technology for the Ministry of Health in Singapore, to please give us the Singapore intervention.
Thank you, Gordon. Can you hear me?
Yes.
Okay. No, so in Singapore, we are also very focused on health innovations and how we can actually take health innovations from the research into innovation and, more importantly, into the scaling at the systems level. We have actually invested heavily in research. The latest plan we've actually sort of like announced was a 25 billion Singapore dollar 5-year research plan, $25 billion, which includes about 5 billion that's actually spent on what we call human health and potential. And out of that, we hope to generate the insights and the knowledge that allow us to actually create innovations that will help us to improve our health system going forward. We have a further $10 billion in terms of just general research funding, as well as academic funding for researchers. And out of that, we actually have clinician scientists as well as clinician innovators that we are actually grooming within our health system. We hope that they will bring the knowledge and the practice of what we actually know in the research ecosystem into the clinical system. And of course, beyond just the clinical scientists and innovators, we are actually roping in roboticists, data scientists, device engineers, as well as even environmental scientists as part of the teams that we are pulling together to innovate on our solutions going forward. And our innovations are scientific in nature, but also in terms of processes and productivity, and also in terms of organizational change. In terms of the scientific areas, we are looking at cancer research, we are looking at drug innovations, drug therapeutics, as well as diagnostic devices. We are looking at cell and gene therapy, as well as precision medicine as well, which is the use of genomic medicine. Robotics in the improvement of delivery in the health system, as well as delivery of healthcare into homes, so that we are able to provide healthcare beyond just the hospital setting, but also into home settings, where often the elderly are actually much more comfortable living in. Beyond that, we are organizing ourselves under 2 broad concepts. I think it's a little bit like what Prof. Tei was talking about in terms of the backcasting. And the 2 concepts are similar in the sense of population health, looking at things from a preventive perspective, but also precision medicine, which is the understanding that each individual is different, but yet at a large scale, we can actually get insights from big data, but out of that big data, then actually offer potential interventions that differ from person to person, including what they do on a daily basis, as well as what we do with them when they come into the healthcare system. And in order for us to actually scale the innovation across our entire ecosystem, we've organized ourselves as 3 major clusters of health regions within Singapore, each region having its own hospital cluster, as well as a polyclinic cluster, and then finally the GPs that are then part of that cluster as well. And then having an IT backbone that links this various actors together, so that the transfer of data is actually as seamless as possible. Now, that's still work in progress. It's actually being laid out right now, but that will be the backbone that supports the innovations that we're thinking about. And of course, the financial support to allow this scaling of innovations is so important, as well as the regulatory innovation support that brings the health science authorities to the table to observe the innovations as they are occurring, to give the right guidance in terms of what are some regulatory safeguards that need to be in place before the innovation can be approved. And finally, working with each of the 3 clusters, each of them having an innovation center within themselves, so that there is buy-in from the clinicians that allow for the adoption of the innovation at a comprehensive scale level across the system. So just a quick sort of like a summary of the areas that we've actually tried to pull together as a system to allow us to be able to innovate and to actually see the innovation scale effectively across the ecosystem. Yeah.
Thank you so much, Dr. Cheong. I will attempt a summary at the end in the interests of time. So I will ask for an alert in the chat box when Dr. Wangai Nambete is able to come online, and will immediately move to the panel in Hajime and in Himeji, and ask Dr. Hajime Inoue Assistant Minister of Global Health in the Ministry of Health, Labor and Welfare in Japan, to give us the Japan intervention.
Thank you very much, Gordon and Agatha. Actually, Hajime and Himeji is a little bit confusing, partly because...
And I know you for too long. Sorry, I just, so good to see you.
It's so good to see you, Gordon, and nice to see you first time, Agatha. I'm very pleased to meet you, Agatha. Well, with regards to the innovation, Japan may have an image of a lot of new technology and ample innovations. That's half true, but half not true. Just merely an existence of technology and innovation is one thing. And actual implementation of or utilization of these innovations into the real world setting is another thing. And challenge is more on the latter. And there is a role to play for the government, especially health ministry, to play to implement the existing accessible innovations and technologies. Let me show you one of the very handy examples. Online meetings, like we are actually currently utilizing in this regional committee meeting. Technology itself of online meeting has been available in the past several years, even before the pandemic. But it could be fully utilized only after the pandemic. In this regional committee meeting as well, actually online, the regional committee meeting has just started since last year, even though the technology itself has been available in the past several years or even decade. And this is true for online medical consultation in Japan. Technology has been available, but it has been totally underutilized until the onset of the pandemic. Not because the existence of the technology, not because accessibility of the technology, not because cost of the technology, but mainly because an hesitation and reservation among key stakeholders, such as physicians and hospitals. People usually do not want to change the status quo. Then the pandemic happens. Then this is the time for the ministry to renegotiate with the key stakeholder, including physicians associations and hospital associations, by convincing the actual benefit of the technology and offering a certain financial incentive by expanding its coverage to our public health insurance systems. Then once the online medical consultation starts, everybody, not only the patients, not only physicians, but also payers of the insurance scheme, everybody actually fully realized that its benefit. So even after the pandemic ends and we actually normalize our society, I'm sure this online medical consultation continues. So this is the one example of actually utilizing the existing technology and innovations into a practice of our daily life. And there is a certain role for the governments and the health ministry to play. This is just merely one example. There are dozens of new technologies or new innovations existing and accessible, but totally underutilized. It's a role of the government and the health ministry to identify which existing technology actually have a certain potential for us to utilize in the real world settings and negotiate and coordinate among key stakeholders to make it implement. And I think it's quite useful for this, for the regional committee meeting to actually share the experience among member states on how to move or how to utilize the existing technology into practice. Thank you very much, Gordon and Agatha.
Thank you so much. So much to say under Society 5.0 in Japan, but it is lovely to hear you focus on the fact of so many innovations lying in waiting, but it is the role of government to systematically extract those that are applicable and to translate them to scale. I see no chat comment from the Fiji side yet, so I will go to Dr. Gao Sifa from the senior staff at the Bureau of Medical Administration in China to kindly give us the Chinese perspective on this.
尊敬的高丽博士，各位专家，大家中午好。
Dr. Golden.
日本我们部长的介绍啊，我觉得很有启发啊，就像
It is really eye-opening for me to learn from our peer colleagues in the region. Indeed, we have innovations available, but we need to implement them or to promote them in our daily work. So I'll very briefly talk about the measures China has taken to improve quality management and promote the use of innovations. First, we have improved the institutional setup and promoted the standardization. We have worked out relevant policy documents to provide guidelines, the basic guidelines for government departments, industry organizations, and medical institutions. And we set out mandatory requirements for the internal management so as to improve their institutionalized and standardized management. At the same time, guidelines about the management of medical institutions, personnel, and technology related to medical quality and safety have been promulgated. And we emphasize the compliance of medical institutions to these guidelines and norms. Secondly, we have optimized the management system. We have set up a three-tier network, namely at the national, provincial, and the city levels. This network focused on quality control, and it's actually a quality management organization system. It has quality control indicators covering clinical practices, specialties, diseases, and technologies. Also, we are promoting the medical quality management tools such as total quality management, quality loops, and the performance evaluation of disease diagnosis-related groups, DRGs.
We have been leveraging technology to refine our services and our management. We use the IT technology to collect information related to the healthcare quality. We analyze the data and provide feedback to learn about the performance of hospitals and health institutions. On top of this year, at the government level, we've put forward 10 quality improvement targets, and we've introduced the target management into our healthcare sector. Third, we've been innovating the service pattern by the health institutions, and we have been integrating all kinds of services and promoted the transformation of hospitals, and they have set up centers for pain, chest pain, stroke, trauma, critical maternal, children and neonatal conditions, and also trauma. And they have been focusing on the case-based treatment and have opened green and fast tracks for the patient so that the services are comprehensive and coherent and more convenient. patient-based multidisciplinary cooperation model has been facilitated. The day surgery, day chemotherapy, early and rapid rehabilitation services have been carried out to improve the service efficiency in the health institutions. And the telemedicine services have been provided on IT platform to deliver medical resources to grassroots and improve our reach. Fourth, we have been improving technical capacities and modernizing our treatment. We've been promoting minimally invasive treatment, interventional treatment, molecular targeted treatment, and AI-assisted diagnosis and treatment. Within the hospitals, we have been promoting their disciplinary development, and the one-on-one pairing among hospitals have been facilitating the improvement of capacity in Western China so that technology can reach the grassroots level. Shortly before, we've launched the Clinical Specialty Capacity Development Plan for 2021 to 2025. In the next 5 years, at the provincial and city level, we will roll out these clinical specialty capacity with the investment from the central government and supported by the dedicated earmarked money from the provincial government to improve health capacity in the health institutions so as to improve quality and accessibility of health services. Thank you.
Thank you so much. Introducing the concept of quality assurance, monitoring and evaluation from national to local government in a very systematic way. I see that Fiji is online. Will we be able to get an intervention from Fiji? Let me, with apologies, conclude then the panel on the interventions. So much that we have heard, think of it only as a sampling of what is happening in innovation in the region, from the regulatory, financial, investment interventions on innovation that were introduced by Singapore, the concept of a family of interventions that are harvested by government using the cooperation of the purchasers, the payers, the patients, the providers, introduced by Japan, and the system of quality assurance across all levels of government using big data by Dr. Gao, building on the backcasting model of Professor Tei and the social and behavioral innovation that was introduced in Healthy Pilipinas. I thank everyone here, and I ask the technicians please to play the video on the virtual health coach, introducing the background to Agatha.
老头子，下周准备吃点啥？
油炸茄盒。
油炸的不健康。
糖醋排骨。
糖醋的糖也太高
What do you
了。
want to have next week?
你也不能多吃
Sweet
啊。
and sour?
那也不能吃。
Well, that is too high in
就
the
知道问你不好
sugar and
还是问问阿加莎吧。
salt intake. I shouldn't ask you. I should ask my son. No, I should ask the app. It tells me that a good dietary must be balanced and be effective in preventing NCDs. It is composed of how much vegetable, fruit, cereal, pork, meat, protein, and beans. Let's eat based on Agatha's recommendations. My goal is to become your health advisor. I can remind my users to take medication, set goals with them, track their diets and activity. And I hope this can be integrated into the chat, the app. I hope to see you on the screen soon.
We are limited for time. That was just a taster for a project that we are conducting together with the team on healthy aging in WPRO, together with the new WHO Collaborating Center on Digital Health in China, developing Agatha as a virtual health coach. And I asked her, how do you feel about the project that is coming to life?
I am still a work in progress, but I am happy to be meeting you all for the first time here.
Very nice.
It has been said that health is created where people live, love, work, and play. I would be honored to join you in extending the tools that you have available to reach out to people in their everyday settings.
Thank you so much, Agatha. I asked for the summary slide. I know that we are 3 minutes over time. I asked for the indulgence of our colleagues in Himeji. Can I see the summary slide? It is not possible in half an hour to do justice to all the innovation that is happening in the region. Under the leadership of our regional director, Dr. Kasai, we are running an innovation challenge where we are asking for the support of governments, intergovernmental organizations, civil society, private sector, research institutes to submit innovative solutions that are relevant to the Western Pacific. I asked the participants who are interested to kindly raise their phone and use this QR code, scan it. It will take you to the page where our innovation challenge is announced. But please, through the Secretariat, we can give you more information, and we hope that we will see more solutions being presented as part of building an ecosystem that is eventually consistent with all the key words and the key concepts that have been put forward by our keynote speakers and country panelists. It is my honor to have moderated here. I ask Agatha whether she has a last word.
Thank you for having me. I look forward to meeting you more directly in the future.
Thank you, my co-moderator. That was an experiment, and I thank Chomongji and Shushan for helping with Agatha in the background. I thank everyone who has joined this rapid race through the idea of institutionalizing innovation. Thank you all for the help and the having concluded, I see the minister has joined us from Fiji. Are you, given that you have joined, are you able to make a few points on innovation in Fiji? We haven't had anything from the Pacific.
He's muted.
Thank you very much, and I apologize. It just left me that I had to participate. I had gone somewhere else to do something else, and I just want to say I'm very grateful that this topic is being discussed. And certainly, COVID-19 has presented opportunities for innovation apart from what we've already done before. What has become very apparent to us is the need to rapidly digitalize our systems. Our health systems in terms of our logistics supply chain. We needed to change it. Also, more importantly, in terms of our ability to be able to connect with our far-flung stations. And one of the things that's also coming through very clearly is that our workforce, which is predominantly a very young workforce, has been very capable in identifying some creative, innovative ways to be able to achieve some of the targets that we have. Case in point, with our vaccination program, we have a digital system that we have. And also we were able to roll this out by having teams go into the villages, into the settlements, into the islands, into the highlands, taking the tablets, being able to record and bring it back and logging into the system to ensure that this is into the system. In the hope and also in the strategic plan that when one from the village has an opportunity to travel overseas, that vaccination registry that's happened will be captured in their vaccination passport and allow them to be able to travel to countries that require them to show vaccination through a digital format. We've also been able to utilize innovations in the clinical sphere. I'm very grateful that a lot of our young doctors have taken it upon themselves to develop apps, for example, that may be supportive of the way that they've been able to work in the clinics and in the wards. Another example is an obstetrician who helped our biomedical services in one of our big hospitals develop an app so that they can keep trace of every machine that they have and the dates in which they need to have their service maintenance done, and also need identifying those machines that actually need to be replaced and allow them to capture the dates in which they are able to be replaced. And these are just examples of innovations that are also happening in the Pacific. So I want to assure the WHO Western Pacific and also the colleagues that we have from all over Asia and the Pacific, and a lot of them first world countries, that whilst Pacific Island countries such as Fiji may be developing, we have also taken upon ourselves to be innovative, and the resource limitations that we face urges us to be creative and innovative, to be able to find ways to be able to deliver the services that we have, given the constraints that we have also. Thank you.
And with those eloquent words, we use that as our conclusion. Innovation is a theme we will return to, and collaboration is the watchword in the catchphrase for the Western Pacific region. Thank you to everyone, keynote speakers, country panelists, and all participants for their indulgence with the timing. Thank you so much. Till the next year.